Right, so we're talking about orthodontics and braces and what role it plays in modern aesthetic dentistry. Orthodontics, braces, very important part. You can't not be offering that today to patients, to adults. If you've got a patient with really good teeth that just needs to be moved, you be able to move them. You don't want to cut them down into veneers or crowns for that matter. And also the patient that comes in and then they've got quite broken down teeth and you want to prepare them for other treatments like implants, like veneers, like reconstruction. And you want to put those teeth into a better position. These types of treatments become very important. It's to create harmony, to create a better framework to work from in the end. Braces ultimately comes down to basically conventional braces, in other words, train tracks, right? Fortunately today, they don't look exactly the same like they used to. We no longer have all these metal blocks, etc., that you would be able to use for children, for instance. For adults, we have them slightly differently. They are a little bit less sightly, although they're not completely invisible. But they are wonderful stuff, and the treatment time frames that we started to utilize on these have changed immensely. So we are able to actually do these treatments in a much shorter time frame. On the other hand, we have modern orthodontics, so to speak, and these are aligner therapies, whereas Invisalign is obviously, they basically pioneered all of this technology, and they are still today probably the most experienced in this field, although there is a lot of other aligner therapy treatments that have come on the market. They become very popular and they become a choice for a lot of patients. Fundamentally, I think the two big differences is that conventional braces are accurate. We know what they can do. We can handle most cases with them. They are often more cost effective, and there are shorter time frames. And then of course the practitioner, basically the orthodontist or the dentist performing the treatment, is really in control, whereas there's not a lot of patient compliance that comes with it. On the other hand, we have aligner therapy. It's a very sexy type of treatment. The fact that you can actually take the stuff out, and make it more invisible in the end, which is appealing to a lot of patients. But there lies its biggest downside, the fact that you can actually take the stuff out. So here, patient compliance becomes really, really important. And therefore, I always warn the patients, say, listen, if you're not that type of personality, if you are not that type of person that's going to diligently wear this stuff, you got to want to stay away from aligner therapy. Ultimately, also aligner therapy sometimes cannot treat all types of treatment. There is a little secret in the corner that, they can't get to all of these treatments necessarily. So again, like anything else, ultimately it becomes the patient's choice, it becomes the practitioner's choice, and of course the guidance that they need to be able to make good decisions. And individually you need to work through it and what type of treatment is going to be important for you, and what's going to be successful in the end. Although, as I said, orthodontics, modern aesthetic dentistry and braces are really a very good match. It has become an intricate detail, intricate part of what we do, and we've been very successful with it. So consider braces. It's not a funny thing anymore. A lot of adults are having them because they are such successful and such predictable type of treatments.